And that's right, good evening. It is Sunday night again, and you know what that means. It's bite-sized learning here at the Ohio Academy of Family Physicians. I'm Dr. Mike Sevilla, your moderator tonight, past president, and we have a great topic, an important topic, something that's very relevant, especially as we record this. It's only a couple of weeks before Election Day in November, and our topic tonight is advocacy. And we have a couple of great OAFP leaders that we're going to be coming up and talking about this. And our session tonight is not only going to be talking about advocacy on the state level here at the OAFP, but also on a national level, because, as family physicians, we have issues that are important not only locally to us, but also at the state level. And at the national level, we're going to be touching a little bit upon the national meetings, the National Conference of Constituency Leaders, which is an AAFP meeting, which we'll talk about. It's coming up in spring 2023, and also the AAFP Congress of Delegates, which is the fall policy meeting, and next year in 2023 will be in Chicago. So before we start our conversation here, I just want to let you know that financial support for Bite-Sized Learning was provided by the AAFP Foundation to the Family Medicine Philanthropic Consortium, and is funded by members like you. Help programs like this continue to support family medicine by giving to the AAFP Foundation. Select chapter grants, the link at the AAFP Foundation. So we thank the foundation for their funding for this program. So let's bring our panelists in here to talk about advocacy. Welcome, Dr. Atkins and Dr. Sharma. Thanks you so much for spending some time with us here this evening.
Thanks for having us, Mike.
Having us.
So, Dr. Atkins, before we start our conversation here, I want you to introduce yourself to our audience. Let us know where you're at, what your practice situation is in family medicine, and we'll start from there.
Sure. So my name is Matthew Atkins, he, him pronouns. I am a family physician in Columbus, Ohio. I am faculty at Grant's Family Medicine Residency Program downtown. So that's a little bit about the basics of where I practice. And I was honored to serve as the LGBT delegate for Ohio to the 2021 and 2022 NCCLs, and then was able to be elected to be one of the co-conveners for next year's NCCCL. And part of that also included being able to go to the Congress of Delegates with these two gentlemen here this past September.
Cool, thanks. And Dr. Sharma, would you introduce yourself to our audience?
Yes, thank you, Mike. So I'm John Sharma, family physician in Van Wert, Ohio, up here in the northwest of Ohio. Been practicing family medicine for almost 15 years. Recently moved to Ohio to work at a community hospital here in Van Wert, where I practice predominantly outpatient medicine. I was very fortunate as well, like my colleague Matt, to be elected by the International Medical Graduate Caucus as a representative delegate from the NCCL, and also participated as an alternate delegate at the recent Congress of Delegates.
Cool, great. Yeah, and we will get into your experiences there in just a little bit. So, so just to let people know, and people who may not be into intricacies of acronyms like NCCL and COD, let's start kind of at a higher level in advocacy in general. And John, I'd like you to go first because you're a newer person to OAFP leadership, which we really appreciate that. Tell the audience here how you first got interested in OAFP advocacy, and why is OAFP advocacy and advocacy in general important to you and your life as a family physician?
Yeah, I think that's a great question, Mike. For me, been practicing rural medicine for quite some time. I felt like I was officially ready to dive into advocacy. I'm a firm believer that we all fall into one of two groups. We're either part of the problem or part of the solution. And working in rural America for quite some time, I felt that complaining about the problems that existed for our patients for our practice of family medicine was just not going to be enough, that I had to take the next step. And for me, that was advocacy. The next step after that, recognizing that I wanted to participate, wearing an advocacy hat, was really finding a vehicle for me in which I could take my advocacy passion to another level. And that's where I became aware of the OAFP. And it was really the advertisement by the OAFP looking for leaders to represent these various constituencies, namely the one that I was most akin with is the international medical grad, since I am one IMG myself. So that's really kind of how I got started in this whole path of advocacy. I really am speaking to, I believe what I can bring to the table is really a calling to my fellow rural family medicine physicians, because I know what they're feeling. I know what they're going through. Sometimes how much we feel like we're working in silos, and we're looking for help, and we may not have all the resources that our colleagues in urban centers may have. And so I want to bring not only their frustrations, sometimes their what they feel might be deficiencies in helping them care for their patients to the table, and have them appropriately represented.
Cool, great. And Matthew, the same question to you. Why is advocacy important to you personally, and why is your involvement in organized medicine, like OAFP, important to you?
Yeah. So a lot of my work at the residency, both in my personal practice and then what I teach, relates to LGBTQ plus health care. And it's certainly something that does not get a lot of main stage center attention when we're thinking about medical school education. So both undergraduate medical education and graduate medical education. I train at a place that prides itself on, or I trained at a place and now teach at a place that prides itself on broad spectrum, full training, and we don't leave anything out. We're going to try to make sure we learn everything that we can to help our patients as family physicians. And still yet, the topics that I do a lot of care for now are things that I still didn't get any of that education, even at a place that prides itself on trying to touch every single base. So I think a lot of the work that I do needs more attention and more support and more advocacy. And I have personal connections from my own upbringing and knowing what it's like to not necessarily be in supportive environments. So I think there's part of that personal impetus that I bring to my work, but also even what I see, the challenges that I encounter within my practice, within teaching residents at the residency. And for our patients, there's so many barriers to care. My patient population, I've only taken new patients that are LGBT folks or people living with HIV for the past 3 or 4 years. So my patient population is very skewed. And I have personally just so much extra administrative work when it comes to prior authorizations and denials and things that my patients can't get. And it's because this area of care needs more advocacy. So I think that's a long-winded answer for why I care about the advocacy part. And then I've had the good fortune of being around and exposed to a lot of folks who work with the OAFP as kind of a window into how I could start to think on bigger levels and go beyond the few hundred patients that I take care of, or the residents that I'm able to teach and educate on some of these topics. There's obviously a whole lot more that needs to be done on a bigger level outside of our system, even within the Ohio health system that I work in. It's statewide, city governments, state governments, national governments. So I was kind of encouraged to start looking into this. And then I found that, as family physicians, the OAFP and AAFP are really, it's our main organization to make change and push for new policy. So I think I've, for a while, been searching for where to make a difference in my people, because in medical school, the AMSA, the American Medical Student Association, was kind of like the it group for me. I was like, wow, yeah, these folks are advocates and care about a lot of the progressive issues that I care about. And in residency and early attending years, I haven't necessarily known where to go. And I think a lot of that's just because I've been so busy anyway, but was lucky enough to kind of be introduced to the OAFP and see that this is actually how some of these larger scale changes can be addressed.
Great, great. Now let's quickly move forward to the national conference of constituency leaders. So as we record this, it's going to be May 9 through May 11, 2023. So put that on your calendars, kids. So I'll start with Matthew first. So I know, as we talk about and we try to introduce this topic to new people who have never been there, it's very difficult. But how would you describe NCCL? And then as you go on in your comments, as far as LGBTQ, your constituency, how did you feel anxious going to your first meeting? Did you think you were going to get your issues being talked about? And then at the end of your comments, what are the maybe 2 or 3 most important issues in your constituency right now, and how were they listened to at the NCCL meeting?
So the first NCCL meeting that I went to was all virtual. So there are pros and cons to that for sure. As someone who has not done a lot of parliamentary procedure or resolution writing and the like previously, I think it was definitely, in some ways, felt intimidating. So I was definitely a little anxious about what to expect. So I think the pros of the first one being virtual is that I kind of was in my computer all the time and able to just be pulling up all of the different documents to go through it. I will say that even though I definitely was anxious and confused and not sure what was going on or what things I needed to be working on, you get lots of support from folks at the OAFP figuring out how to navigate some of it. And then when you're at the actual NCCL, you definitely have folks who have been there before. I feel like the great majority of folks are people who have some sort of experience with the conference. That was part of the first question, and you were talking about the 3 important areas. I think there was another.
Yeah. Just specifically for your constituency, because each constituency has topics that are very important to them. What were the important topics that were discussed, and did you feel like other members were able to hear? Do you feel like the AFP was able to hear you on those specific important issues?
Yeah. Care for gender diverse youth came up quite a number of times between the NCCL and the Congress of Delegates this past year. There's lots of topic breakdowns within that, but I think care of gender diverse youth was a very common theme. Access and education for pre-exposure prophylaxis for HIV came up multiple times. And there were lots of things talking about discriminatory and inclusive language for things that came up. I'd say those are 3 fairly big topics that were brought up through various resolutions and policy debates. So I probably could list a lot more, but those were the first 3 that came to mind at first.
Great, thank you. So John, so the same question. So it's hard to describe NCCL to somebody who hasn't been there, but how would you describe, what NCCL is, what your first experience was, and being in the constituency of international medical graduates? Did you feel welcome when you were talking about your topics, and what are maybe 2 or 3 important topics specifically to the IMG community that your group talked about?
Sure. I think the first part was the introduction to NCCL, because this was, for as long as I've been in clinical practice, and I was aware of NCCL going to a lot of the FMX Family Medicine Experience conferences, but just didn't take that next step to becoming or getting involved. So there were definitely a lot of nerves and anxiousness. What am I getting myself into? Is this the right path? I'm, no one's paying me to say this, but I'm glad I took that step forward. I kind of look back and say, I wish I had taken some of these steps a little bit sooner. So that's one of the things that I would like to get across to viewers is whatever you're feeling, whatever anxieties you may be feeling about taking an advocacy step forward, they're shared. You're not alone. Just take that step forward and meet your colleagues who are coming from similar paths. So that's one of the things when I got into the IMG caucus room there that I felt I'm not alone. I also it was a very humble experience for me, I would say, because listening to my IMG colleagues, I recognized how fortunate I am that despite being an IMG and now practicing in the United States, I'm very fortunate and dare I say even lucky. We all have worked hard to get to this point, and listening to the stories of issues that a lot of our well-trained international medical graduates are facing to become legally employed in this country, and especially in primary care. My gosh, we got work to do. Some of those issues, some of those hot topic, critical mass areas that I like to call them are like definitely workforce shortages areas, pay parity, licensure, GME funding for more residency positions, immigration equity. Now, some of these are very big topics that, that the AAFP, has addressed, but we're dealing with federal policy as well, and that takes time. I want my IMG colleagues to know that their worries, their frustrations are being heard, but we need more passionate individuals to come to the forefront to convey these hardships that we're especially seeing in this particular constituency. I personally don't believe, as I shared in the IMG caucus, that we have truly a physician shortage issue in this country. We have a lot of well-trained physicians, and the problem is just getting them appropriate licensure. Some of them are having immigration issues, not just for themselves or for their immediate family. COVID-19 brought this to light quite a bit, and it was really, I know you're going to bring up Congress of Delegates shortly, but it was really nice to hear at the Congress of Delegates that there are initiatives and there are efforts being made in this regard. Conrad waiver program, helped to address some of these issues as well. So, yeah, while I was feeling anxious and nervous coming into it, I think that anxiety was dissipated with a sense of actual gratitude of where I am, and I want to take that gratitude to another level with this advocacy. And I was very thankful that my IMG colleagues elected me as a co-convener for next year's NCCL. And then I'm sure, much like Matt, we were very grateful that we were selected as alternate delegates to the COD. It's just an amazing experience to finally be there with your colleagues who share the same passion and energy and motivation. We're all truly in this together. And that's why I come back to my original point. It's, I wish I was there and I had taken these steps earlier.
And just to let the audience know, the other constituencies that go to NCCO, there's a minority constituency,
Right.
there's a women's constituency, and then there's a new physician constituency. You can get all that information at ohioafp.org. And as we kind of roll out our promotion of this meeting, trying to get OAFP members to attend, trying to get them to run for national leadership positions, you're going to hear more about that. So John, you kind of lead it into talking about Congress of Delegates. So why don't we just make that our next topic? And the Congress of Delegates, AAFP Congress of Delegates, American Academy of Family Physicians Congress of Delegates is the policy-making body of the organization. The meetings every fall. Both you and Matt, they were there leadership positions, so be there in leadership positions next year. So again, very similar question for OAFP members, AAFP members who have not attended that part of that meeting. Usually more people go to FMX, but how was your Congress of Delegates experience? How would you describe the Congress of Delegates experience?
Sure. I'm sure Matt would agree, since we were sitting beside each other. It was overwhelming, to say the least. Lots of information, and so processing all that information in a 2.5-day period was, I'll be honest about this. Not that I would. There were parts where I wished I was back in the office, but. Sorry, my screen's gone a little funky here, but
oh, we can still see you.
Okay, there.
Yeah, you're still there.
So overwhelming for sure, but quite frankly, I wasn't surprised. I was, based on all the preparatory work, and kind of I should have alluded to this or made mention of this in the previous question segment. The OAFP group prepared us very well, not just for NCCL, but also prepared us to anticipate a lot going on at the COD. It wasn't that we were flying blind by any means, but just for somebody coming in brand new, I mean, it is a lot of information that is thrown in. And I think a lot of it was because we were handling resolutions, not just from 2022, but also from 2021 as well. But what I really discovered was this internal, the internal machinery, if I can call it that, or the inner workings of our family medicine advocates from all states where we're represented, to help basically coordinate legislative and these regulatory changes that ultimately help family physicians and our patients across the nation. So I think we actually have a really, really big problem in primary care. And where I'm coming from when I say that is really a positive stance, because as all of us delegates, I think, we're witness to, especially as new ones, we can actually now say that we're a part of this vehicle for change, I guess, made up of motivated and passionate family physicians driving various advocacy agendas. So I say it's a problem mostly for anyone who gets in our way. So just watch out, because we do mean business. We're addressing hot topic, big issue items like prior authorizations, HIPAA updates, restrictive covenants, for example, stakeholder metrics. I really enjoyed the conversation that we had on stakeholder metrics, because we're really taking what CMS evaluates physicians and practices on, and now turning that over to the insurance companies and saying, hey, we're looking at you. So we're really making a push here. I mean, that's why I said, I mean, anyone that's in our way, I think they better understand that we as family physicians mean business. We're trying to make this specialty stronger and better for ourselves as practitioners, and more importantly for our patients. So that's really kind of the general feeling, impression that I got at my first COD.
Cool. Thank you. Thank you. And Matthew, your impressions, your experience at Congress of Delegates this year.
So I think the NCCL was definitely a nice precursor, because a lot of some of the inner workings when it comes to the resolution writing and then having them divided up into reference committee agendas and the debate and how you kind of go through all of those and the hearings, and then how debate is done on the floor. I think it was a nice precursor from NCCL translating into COD, because much of the same structure and agenda is in place. I think when you're at NCCL, you're part of the representing the various minority constituencies. And it feels a little unclear how that's going to actually end up influencing the National Congress of Delegates. So I think it was kind of nice to see how all of that came together, so that you could see lots of folks that you saw at NCCL. Put too many C's in there that time, but you could see all the folks who were there at Kansas City earlier in the year, and how a lot of it's kind of woven together. And also just see like, oh, wow, like the folks that are here debating things on the floor or bringing up stuff are folks as like the representatives from all of the various states around the country. And I feel like there's definitely a bit of gravity for like, oh, this is how the organization that represents all of us in big forums when it comes to national politics or advocacy, this is how decisions are actually made, or how we kind of move the needle on things that are important to us. Many of the issues that John had mentioned, when it's across the board. So I think it was definitely, I can agree with him that it felt overwhelming. But at the same time, I think, you kind of expect that. And I don't know that the inner workings in the policymaking meeting or body of the National Academy, if it didn't feel a little bit heavy and confusing, I mean, I guess I think we kind of knew to expect that. And having the Ohio group there, I don't think this year was an exception. We had a big group of Ohio people. So I feel like that's always the case. And so you always got to be able to ask other folks from the Ohio group, what does this mean? I certainly asked lots of questions. So I know these two can attest to that, because if I don't understand how this is working, I'm not gonna be able to participate. So you have a lot of support, even though it's seems like a lot at first. And it's just great to see that this is actually how we end up making a difference with the National Academy.
Cool. I can't believe that the time has went so quickly. I'm going to ask both of you just for some closing thoughts, but I do want to let the audience know that here at OAFP, we're really pushing toward. We listen to what you're saying as members, and you're telling us that we need to be more at the table when it comes to advocacy issues. And we have new legislative staff for the OAFP. You're going to be hearing from them very soon for the OAFP to be more of a player at the State House in Columbus. And we know that there are important issues here at the state. There's also important issues at national level. And here at OAFP, we've been really trying to reprioritizing and reorganizing to try to put our efforts and put a little bit more energy into state issues. And we hear you about that. So we ask you to be patient with us, and as we're getting everything organized there. And I was at a meeting recently, where OAFP staff is really breaking down specific, House bills at the state level, Senate bills at the state level, to try to present that to you as the OAFP member, because we know that you have a very busy doing your thing at home, and we want to try to give you the best information, the most relevant information at the State House as best as we can. So So that information will be coming out soon. So as closing thoughts for both of you, what I would ask you to do is just to frame it as far as that OAFP member who is not sure whether they want to be an advocate. They're not sure if they have the time to be the advocate. They're not sure if that somebody's listening out there. So my last question, and you can add anything in your closing remarks, is why should OAFP members be advocates for our patients and community? Why is it worth it to be a part of the OAFP? And why should family medicine be a part of the solution to what's going on with our patients? Matt, I'll have you go first.
Yeah. So I feel like it's just kind of built into the definition of being a family physician is that we are advocates for our patients, kind of whether we like it or not a lot of times. So I think it depends on how we choose to get involved with that advocacy, because there's certainly more than one way to be an advocate. I think if we look at the grand scheme of things, these structures that are in place that we have to practice within and our patients live within are there. And so the OAFP is our state representative for all of us family physicians. And I think sometimes for me, it seemed like this nebulous organization. I wasn't really sure what they did necessarily, even though I knew lots of people that were involved with them. And I think a lot of times, like I already alluded to, parliamentary procedure and various things felt foreign to me. And it felt like, oh, I can't take on something new. But I think what I would say to folks out there is that if you're curious at all, you should get involved, see what you can get hooked up with. You can come to info sessions. You certainly don't have to make commitments because everyone's really supportive and knows that we're all really busy. So I think if you're curious at all, the OAFP staff is really great with trying to find places that we can fit in, and just even sitting in on some meetings to try to absorb some of it, I think would be welcome. And I would just say to not be overly worried about the time commitment, just to reach out and see what it's like to get involved. Because like I said, we're advocates whether we like it or not, and the OAFP is our representative here. So I think it's definitely been a worthwhile experience for me, and I've learned a lot so far, and I'm excited to keep learning. So definitely would encourage anyone to check it out if you're at all curious.
Cool. Thanks, Matt. And John, I know that you probably have little to say about advocacy to close us up here, but take us home here. What you're passionate on advocacy? Why should the rank and file OAFP member get into advocacy, and why should OAFP be the place they should go?
Yeah, I think bottom line, whether you're urban, rural, academic, non-academic center, practicing family physician, listen, at some level, I believe you're already an advocate. Whether you're an advocate for your patients, your practice, or even personally, all right, there's some hint of advocacy in all of us. So tap into that is what I would reach out to listeners on. Tap into that advocacy first and foremost. Know that you have, number two, know that you have a vehicle or a number of vehicles in which to drive that advocacy, either at your local level, but definitely at the state level with the OAFP. We get in, just even take a step forward, get involved, get to know us, and you'll know that we share some of those similar frustrations, but we're all passionate in terms of improving things for our patients, life for our patients, our own lives, and our practice. And then from there, you can determine whether that's where you want to keep your advocacy efforts in, or you want to take it to the next level through the AAFP. The advocacy, I believe, is there in all of us as family physicians. The vehicles are also there. And I think it's just a matter of making sure that listeners understand that, we are a community here to help each other out ultimately and to help other patients.
Cool. My closing thoughts are: resident students, we have not forgotten about you. A lot of people, including me, believe that resident students are part of who drives this organization. So we have not forgot about you. You know, there are avenues, there are channels where resident students can also have your voice, not only here at the state level, but also at the national level. So we don't want to forget about you as well. It's been a great conversation tonight. I want to thank both of you for being here. You can get more information at ohioafp.org. You can listen to this on an archive at the OAFP website, and we'll also be streaming this on Facebook and also on our YouTube channel. Yes, we have a YouTube channel. You can watch past programs there. Anything else from either of you before we close things up? I think you did a great job tonight.
I think so.
Great. All right, great. That ends our program. I'm Dr. Mike Sevilla. Thank you for joining us for Bite-Sized Learning, and good night, everyone.